For decades, we've been handed one simple, unwavering rule about staying strong as we age. If you want powerful legs and a resilient body, you must squat. Squats have been crowned the king of exercises, and for young, agile bodies, that might hold true. But here's a reality that's rarely spoken aloud. As the years add up, our bodies change, and what worked at 30 might not serve us at 60. Consider this. More than 1 in 4 adults over 65 falls each year, with balance issues, hip weakness, and lower body instability being prime culprits. So if squats are so legendary, why do so many people over 50 still grapple with back pain, knee discomfort, poor posture, and unsteady walking, even if they've tried squatting religiously? The answer is startling, and it has everything to do with a muscle group that's often neglected, your glutes. Today, we're going to challenge that age-old belief and explore two smarter, safer exercises that could transform how you move, feel, and age. Let's unravel this paradox further. We're told that squats are a full-body compound movement that builds strength from the ground up. And while that's not entirely false, it's an incomplete picture for aging bodies. As we cross the threshold of 50, our physiology shifts. Muscles naturally lose mass and elasticity, joints become more susceptible to wear and tear, and years of sedentary habits, like sitting at desks, in cars, or on sofas, take a toll. Specifically, our gluteal muscles, the powerhouse of the lower body, often fall into a state of dormancy. This phenomenon, sometimes called gluteal amnesia, means the brain-muscle connection weakens, and these critical muscles simply don't fire as they should. When that happens, other parts of the body overcompensate. The lower back bears extra load, the knees endure undue stress, and posture gradually hunches forward. The result? A higher risk of falls, reduced mobility, and chronic pain. Yet the fitness world continues to preach squats as the ultimate solution, but research tells a different story. Studies using electromyography, EMG, to measure muscle activation reveal that squats often engage the quadriceps and hamstrings more than the glutes, especially when form is compromised. For individuals with pre-existing knee or spine issues, squats can exacerbate pain rather than alleviate it. So, the very exercise touted for strength might be undermining your stability. This isn't to say squats are useless, they have their place, but for many over 50, they're not the most efficient or safest way to rebuild the strength that matters most, glute strength. To understand why glutes are so crucial, let's look at their anatomy and function. The gluteal complex comprises three main muscles: the gluteus maximus, gluteus medius, and gluteus minimus. The gluteus maximus is the largest and most powerful. It's the primary engine for hip extension, essential for activities like standing up from a chair, climbing stairs, or walking uphill. The gluteus medius and minimus, though smaller, are vital for hip abduction and stabilization. They keep your pelvis level when you walk or stand on one leg, preventing that wobbly, uneven gait that can lead to falls. When these muscles are strong and actively engaged, they form a robust foundation for your entire body. They support the lumbar spine, reducing the risk of lower back pain. They stabilize the hips, which in turn protects the knees from abnormal forces. They even contribute to an upright, confident posture. But when they're weak or inactive, the domino effect begins. The body, in its ingenious but flawed way, recruits other muscles to pick up the slack. The hamstrings and lower back become overworked, leading to strain and discomfort. The hip flexors tighten, pulling the pelvis into an anterior tilt that flattens the natural curve of the spine. Over time, this muscular imbalance can accelerate joint degeneration, foster poor movement patterns, and erode your quality of life. The irony is that modern life conspires against our glutes. We sit for hours, at work, during commutes, while relaxing, and sitting effectively switches off the glutes. The brain learns that these muscles aren't needed, so it stops sending strong signals to them. Even when we exercise, if we're not targeting the glutes specifically, they might remain dormant. That's why generic exercises like squats, which involve multiple muscle groups, might not wake them up. You could squat until your legs burn, but if your glutes aren't activating, you're missing the point. So, what's the alternative? Instead of forcing your body into movements that may not suit your current needs, we focus on two exercises designed to directly and intentionally activate and strengthen the glutes. These are the modified step down and the hip thrust with a scoop motion. Both are low impact, joint friendly, and highly effective at recruiting the glute muscles where they're weakest and where they're strongest. Together, they create a comprehensive glute training regimen that can restore balance, enhance stability, and reduce pain. Let's start with the first exercise, the modified step down. At first glance, this movement seems simple, almost too simple. But don't be fooled. Its simplicity is its strength. The modified step down targets the glutes in their lengthened position, which is precisely where most older adults are deficient. When you sit for prolonged periods, the glutes remain in a shortened state, losing their ability to contract fully through a range of motion. This exercise counters that by emphasizing a controlled hip hinging motion that isolates the glutes without imposing excessive stress on the knees or spine. Here's how to perform it correctly. Find a sturdy step or low platform about knee height. Stand on it with both feet, then let one foot hover just off the edge. Slowly lower that hovering foot until the heel lightly touches the floor. As you do this, hinge at the hips. Imagine you're trying to sit your butt back into an invisible chair behind you. This hip hinge is key. It ensures the glutes are doing the work rather than the quadriceps. Pause briefly at the bottom, then press through the heel of your standing leg to return to the starting position. The movement should be slow and deliberate, taking about 3 seconds down and 3 seconds up. Avoid rushing or using momentum. To maximize benefits, keep your knee aligned with your foot. Don't let it cave inward or shoot forward. If you're new to this, use a wall or a chair for balance until you feel steady. For an added challenge, hold a dumbbell in the hand opposite your working leg. This introduces a slight rotational torque that forces the gluteus medius to engage more intensely to stabilize the hip. Why is this exercise superior to squats for those over 50? First, it minimizes pressure on the knees and spine because the range of motion is controlled and limited. Second, it ensures targeted glute engagement by isolating the hip hinge. Third, it's easily modifiable and can be done at home with minimal equipment. But beyond strength, it trains control and balance, two elements critical for fall prevention and confident walking as we age. Now, onto the second exercise, the hip thrust with a scoop motion. While the modified step down focuses on the glutes in a stretched position, the hip thrust builds power at the peak of contraction. Think of it as training both ends of a rubber band. One exercise stretches and strengthens, the other teaches you to snap it back with force and control. The hip thrust is renowned for its ability to activate the glutes intensely, often more so than squats, according to EMG studies. But the technique is everything. A common mistake is to arch the back excessively, which shifts the work to the spine and hamstrings. The scoop motion prevents that by emphasizing a posterior pelvic tilt that keeps the glutes in the driver's seat. To execute the hip thrust properly, sit on the floor with your upper back resting against a stable bench or couch. Your knees should be bent, feet flat on the floor, positioned so that your shins are vertical when your hips are fully lifted. Place your hands on your hips or hold a light dumbbell across your lap for resistance. Drive through your heels to lift your hips toward the ceiling, squeezing your glutes tightly at the top. Now, here's the scoop. As you reach the peak, tuck your chin slightly, draw your ribs down, and imagine scooping your pelvis upward as if zipping up a tight jacket from the bottom. This motion protects your lower back by maintaining a neutral spine and ensures the glutes are fully contracted. Hold the top position for a second, then lower with control. Avoid these common errors, using a bench that's too low, which makes the movement unstable, placing feet too close or too far from the body, which recruits the quads or hamstrings instead, and hyperextending the back, which reduces glute activation and risks injury. The beauty of the hip thrust is its direct isolation of the glutes with minimal joint stress. It's a low-impact exercise that delivers high rewards in terms of strength, posture, and functional mobility. Knowing the exercises is one thing, integrating them into a sustainable routine is another. After 50, consistency trumps intensity every time. Your body responds best to regular, moderate stimulation rather than sporadic, intense bouts. Leading physical therapists and geriatric fitness experts recommend performing these two exercises 2 to 3 times per week. Start with 3 sets of 8 to 12 repetitions for each exercise. Focus on mastering the form before adding weight or increasing difficulty. If you experience muscle soreness, that's normal. It's a sign of adaptation. But avoid pushing to the point of pain or fatigue that interferes with your daily activities. Remember, the goal is to stimulate, not annihilate. Gradual progression is key. As you grow stronger, you can add resistance via dumbbells or resistance bands, or increase the height of the step for the step down. Consistency also means listening to your body. Some days you might feel energized and capable of extra sets. Other days you might need to scale back. That's perfectly okay. The journey to stronger glutes isn't a sprint, it's a marathon. By sticking to a regular schedule, you'll notice improvements in stability, posture, and ease of movement within a few weeks. These small wins build momentum and reinforce the habit. Exercise alone isn't enough. Muscles require proper nourishment to repair and grow, especially as we age. After 50, muscle loss, known as sarcopenia, accelerates due to hormonal changes and reduced physical activity. To combat this, protein becomes paramount. Aim for 1.0 to 1.2 grams of protein per kilogram of body weight daily. For example, if you weigh 70 kilograms, that's 70 to 84 grams of protein per day. Spread this intake across meals to optimize absorption. Excellent sources include eggs, Greek yogurt, tofu, cottage cheese, lean meats like turkey or chicken, and fatty fish such as salmon or sardines. Plant-based options like lentils, chickpeas, and quinoa are also valuable. But protein isn't the only nutrient. Carbohydrates provide the energy needed to fuel your workouts and recovery. Opt for complex carbs like whole grains, sweet potatoes, and legumes, which release energy steadily and prevent blood sugar spikes. Healthy fats found in avocados, nuts, and olive oil support joint health and reduce inflammation. Hydration is equally critical. Water aids digestion, circulation, and joint lubrication. Aim for at least 8 glasses daily, more if you're active or in a hot climate. If you have underlying health conditions like diabetes, kidney disease, or gout, consult a registered dietitian or your doctor to tailor these guidelines to your needs. Nutrition isn't about deprivation, it's about fueling your body to thrive. By pairing smart eating with targeted exercise, you create a synergy that maximizes strength and vitality. Your workout routine is just a slice of the pie. What you do throughout the day profoundly impacts glute health. Prolonged sitting is the arch nemesis of active glutes. To counteract this, weave movement into your daily life. Set a timer to stand up and stretch every 45 to 60 minutes. Take a short walk after meals. Even 10 minutes can boost circulation and reactivate muscles. Choose stairs over elevators whenever possible. These micro movements might seem insignificant, but they reinforce neural pathways to your glutes, keeping them awake and engaged. Another helpful habit is to practice mindful standing. When you're waiting in line or brushing your teeth, gently squeeze your glutes and engage your core. This not only strengthens muscles, but also improves posture. Additionally, consider incorporating walking variations, such as uphill walking or brief intervals of faster pacing, to challenge your glutes in functional ways. The idea is to make movement a natural, frequent part of your day, not just something confined to exercise sessions. Before you begin, a crucial reminder. The information shared here is for educational and wellness purposes. It is not a substitute for professional medical advice. If you have chronic pain, injuries, or any health concerns, please consult your doctor or a physical therapist before starting new exercises. Every body is unique, and a healthcare provider can help you adapt these suggestions to your individual circumstances. Safety always comes first. Embarking on this journey doesn't require perfection. You don't need to lift heavy weights or compare yourself to younger gym goers. What matters is consistency, patience, and self-compassion. Start small, maybe with just one set of each exercise twice a week. Listen to your body's signals, celebrate progress, and stay curious about how your strength evolves. Over time, these 2 exercises can lead to profound changes: a steadier walk, less back pain, improved balance, and a greater sense of independence. Let's consider the broader implications of glute strength on overall health. Strong glutes do more than prevent falls. They influence metabolic health. Muscle tissue is metabolically active, burning calories even at rest. By building and maintaining glute mass, you boost your basal metabolic rate, which can help manage weight, a common concern as metabolism slows with age. Moreover, strong glutes improve circulation in the lower body, reducing the risk of venous insufficiency and swelling in the legs. The psychological benefits are profound. When you feel physically stable, confidence soars. You're more likely to engage in social activities, travel, or pursue hobbies that require movement. This positive feedback loop enhances mental well-being, reducing anxiety and depression linked to mobility limitations. In essence, strong glutes contribute to a vibrant, engaged life. Now let's address common questions and misconceptions. Some might worry that focusing on glutes will lead to a bulky appearance, but muscle hypertrophy requires significant resistance training and caloric surplus, which is unlikely with these moderate exercises. Instead, you'll develop toned, functional muscles that support your frame without adding bulk. Others might question whether these exercises are enough for overall lower body strength. While they target glutes primarily, they also engage the core, hamstrings, and stabilizers. For a well-rounded routine, you can add exercises like calf raises, ankle mobility drills, and gentle cardio. But for many, glute training is the missing link that unlocks overall improvement. Another aspect is adaptability. These exercises can be done anywhere, at home, in a park, or even in a hotel room while traveling. No fancy equipment is needed. A step can be a stair, a sturdy book, or a low bench. For hip thrusts, a couch, bed, or bench works. This accessibility ensures you can stay consistent regardless of circumstances. Let's delve into the science of muscle activation. EMG studies show that during squats, gluteus maximus activation peaks at parallel depth, but many older adults cannot squat deeply due to joint limitations. Thus, they miss the optimal range. In contrast, Step downs and hip thrusts maintain high glute activation throughout the movement, even with shallow ranges. This makes them more inclusive and effective for those with mobility restrictions. Furthermore, these exercises promote bilateral equality. Asymmetry is common with age, one side often weaker than the other, leading to compensatory patterns. By performing exercises unilaterally, like the step down, or with focused control, like the hip thrust, you can identify and correct imbalances. This symmetry is crucial for balanced gait and injury prevention. Nutritional nuances. As protein needs increase with age, digestibility becomes a consideration. Older adults may produce less stomach acid, affecting protein breakdown. Including fermented foods like yogurt or kefir or using digestive enzymes can aid absorption. Also, spreading protein intake across 4 to 5 smaller meals can be more manageable than 3 large ones. Hydration tips: infuse water with lemon or mint to make it more appealing. Monitor urine color. Pale yellow indicates adequate hydration. Avoid excessive caffeine or alcohol, which can dehydrate. Daily habit examples. Set a phone reminder to stand every hour. Use a standing desk if possible. Park farther from store entrances to walk more. Do glute squeezes while watching TV. Take walking meetings if you're on the phone. These habits accumulate into significant activity boosts. Safety reminders. If you experience sharp pain, dizziness, or shortness of breath during exercise, stop immediately and seek medical advice. Never push through joint pain. Use pain as a guide. Mild muscular discomfort is okay, but joint or nerve pain is not. Finally, embrace a growth mindset. Aging is not about loss, it's about evolution. Your body is capable of adaptation at any age. By choosing exercises that respect your current abilities while challenging your potential, you honor your body's wisdom. The modified step down and hip thrust are more than exercises. They are acts of self-care that reaffirm your commitment to living fully. So, take that first step, literally. Try a set of step downs today. Feel the muscles wake up. Notice the difference in your stance. Then, add hip thrusts. Build gradually. Share your journey. And remember, every rep is a step toward a stronger, more stable you. The king of exercises isn't a squat. It's the exercise that serves you best. And for many over 50, that's glute-focused training. Here's to moving better, feeling better, and aging with strength and grace.